Have you ever felt tingling fingers, mood swings, or brain fog, and chalk it up to stress? By default told you, these could be your body's varied SOS signals, screaming for vitamin B12. Vitamin B12, also known as cobalamin, is a vital nutrient that plays key roles in the red blood cells formation, nerve function, and DNA synthesis. In a modern life, with a processed diets, restrictive eating patterns, and gut health issues, mild to moderate B12 deficiency is more common than many realize. Below, we dive into a 5 red early signs your body might be craving B12, explore root causes, peer into scientific insights, suggest lifestyle fixes, and encouragement. You may feel very tingling or numbness in hands, feet, or limbs, as through your nerves as a misfiring. B12 is essential for maintaining the myelin sheaths around nerves. Deficiency can lead to peripheral neuropathy or demyelination of nerve fibers. Sudden mood swings, irritability, or feeling emotionally fragile may stem from disrupted neurotransmitter synthesis. B12 is closely tied to the pathways that regulate serotonin, dopamine, and homeostasis metabolism. You might find yourself forgetting names, misplacing keys, or mentally sluggish. Low B12 levels have been linked to worse memory performance, even with normal range, and a cognitive impairment in a more overt deficiency. Your tongue becomes sore, swollen, smooth, or red, perhaps with the cracks in the corners of your mouth. Early signs of a mucosal tissue distress from B12 shortfalls. Also broad review of a clinical presentation. Feeling of balance or a lightheaded when standing can be tied to mild spinal or a nerve interference in the dorsal columns, sensory tract, where B12 deficiency may impact proprioception and nerve conduction. You may not show classical anemia, macrocytosis, but assist often neuropsychiatric symptoms. A strict vegan or vegetarian diets or avoidance of dairy or meat over years can drain liver from B12 stores. Problems in the stomach or small intestines, reduce intrinsic factor, trophic gastritis, celiac disease, Crohn's disease, gastric bypass can block absorption. Long use of protein pumps inhibitors, H2 blockers, or metformin in diabetes can interfere with the B12 absorption. Risk factors. Aging often brings reduced stomach acid and subtle gut change that hamper B12 release from food proteins. Recreational nitrous oxide use or oxidative stress can inactivate B12's active form, pushing you toward functional deficiency. B12 deficiency doesn't always show up as anemia. Many patients present predominantly with neurological or psychiatric symptoms without macrocytosis. In older adults, supplementation of B12 in those with overt deficiency has been shown to improve neurological symptoms. Case reports show that a patient with a myelinating peripheral neuropathy due to B12 deficiency achieved full reversal after B12 therapy over mouse. Meta-analysis of the trial indicates that B12 supplementation in non-deficient individuals is less likely to enhance cognitive outcomes. Electrophysiological studies demonstrate that poor B12 status correlates with the lower nerve conduction velocities and the worse sensory performance. In short, early diagnosis and reflection matters. If deficiency is advanced and untreated too long, some nerve damage may become irreversible. Focus on the B12-rich foods like liver, columns, lambs, beef, fish, eggs, dairy. For plant-based eaters, fortified foods. Nutritional yeast, fortified plant milks, cereals have a B12 supplement. Ensure you get supportive nutrients like folate, B6, and riboflavin. We synergize in methylation cycle. Under medical guidance, high dose of oral B12 periodic injection may be used, especially when absorption is impaired. In neurological cases, intramuscular hydroxycobalamin has shown reversal of neuropathy. Promote stomach acid. Avoid overuse of acid blockers. Consider digestive enzymes if advised by clinician. Supportive gut integrity. Probiotics, fiber, gut-friendly foods manage inflammation. Reversible, repair regeneration, moderate exercise to improve circulation and neural health. Avoid excessive alcohol, smoking, and oxidative stress. Monitor interacting medications with your physician, especially metformin, acid suppressants, minimal B12 levels, methylmalonic acid, hemostasis. Track symptoms change over 3 to 6 months of therapy. These steps often yield gradual improvement if initiated before severe, permanent damage sets in. Your body constantly speaks, even through subtle strange sensation or shift. Paying attention to very little signs can mean catching a deficiency before it spirals into something harder to reverse. With knowledge, the right diet, and medical support when needed, many B12-related symptoms can be erased or softened. Don't wait until things get drastic. Commit today to listening to your body, checking your health, and acting early. If you like this video, your health is an investment. Stay curious, stay strong.